So continuation of angina pectoris, we have seen that it is a chest pain that is occurring because of myocardial ischemia. So we will move on to the management. So before dealing with the medical management as well as the nursing management, we will see what are the mnemonics that is usually done for angina pectoris. Okay, so this mnemonics you can remember it easily. So first of all, A. Okay, A stands for aspirin. Okay, aspirin is a most common antiplatelet drug that is given. Then anti-anginals have to be given. Okay, like anti-anginals commonly that is given as nitroglycerin. We have got nitrates. Okay, or vasodilators that will be given that reduces the anginal pain. Antiplatelets. Okay, and A also refers to ACE inhibitors, that is antihypertensives like captopril and enalapril. B stands for controlling the blood pressure and also beta blockers. Okay, so beta blockers example is etonolol, propranolol. Okay, and C, better to quit cigarettes. Okay, that will reduce the risk factor and also to keep the cholesterol in control. Next, D stands for diet. We know what type of a diet is being advised, isn't it? Low sodium diet. Along with that, sugar or sweet products should be avoided. Oil and fats have to be avoided, and consuming more of green leafy vegetables and fruits. Next is controlling diabetes mellitus. E stands for health education to the patient and the family regarding the lifestyle modification and the other things regarding the disease condition. And E also stands for exercise. We know physical activity benefits the patient. And F stands for flu vaccine. Okay, so which vaccines are available? Flu vaccines have to be taken. Okay, that importance you will come to know in the condition that is endocarditis. Next, most of the time, what we have to do in the case of chest pain, when the patient is experiencing chest pain, we cannot just continuously ask with the patient regarding the history or go on performing physical examination. We have to be very quick. So, usually the patient will come to the casualty or to the emergency. Immediately, when the person is coming with the chest pain, you have to suspect that it could be a heart attack or it is an anginal pain. Okay, so immediately most of the time they will connect the patient to the cardiac monitor. They will check the vital signs immediately, and then immediately we have to start with morphine. Okay, so morphine is a drug that is first preferred. It reduces the anxiety in the patient. So what happens is it will automatically reduce the workload on the heart. When you are panicked, what will happen? Your heart rate will increase, you will have palpitations, you will be more and more fearful. Okay, so here most of the time morphine is given. One is to reduce the anxiety, and one more is it is a drug that reduces the pain. Okay, we you may be aware about lot of analgesics, isn't it, like your ibuprofen, paracetamol, and all. Now, those drugs are not at all effective here for the chest pain in MI. Okay, that is not effective. So, we are giving the drug morphine. Next, mainly what we do is immediately we will start with oxygen therapy for the patient because we have to reduce the workload on the heart. So, you can start with the oxygen therapy. Okay. So you will be monitoring the oxygen saturation also, and along with that we know that there are different methods to administer oxygen, isn't it? Like we can start it from nasal cannula, nasal prongs. Okay, we have got the mask, isn't it? So any way can be used to deliver the oxygen therapy. Okay, commonly we will use a nasal prongs. Next is nitroglycerin. Now nitroglycerin is a drug of choice for the patients with angina. Okay, it reduces the it relaxes the myocardium and it will reduce the workload on the heart again. Okay, and A, as I told, aspirin, that we have seen in the previous slide also. Okay, so remember MONA. Okay, morphine, oxygen, nitroglycerin, and aspirin. Now we will see in detail regarding the medical management. Okay, so first of all I told we will be giving analgesics to the patient in order to reduce the chest pain. Here we give us morphine. Next is vasodilators. What does vasodilators do? They dilate the smooth muscles, okay, and they will help to provide more and more oxygenation and blood flow to the myocardium. Okay, and commonly we are using the vasodilator nitroglycerin. Nitroglycerin is available in the form of tablets, creams, sprays, and many other ways. Okay, so most of the time if tablets are taken, it is kept under the tongue. Okay, so maximum of usually 3 tablets are given. Okay, and after taking nitroglycerin, it is seen that the pain will reduce within 1 to 2 minutes. Okay, but in certain cases when there is an MI, okay, sometimes even nitroglycerin may not be very effective, like in unstable angina. Okay, but most of the time immediately it will reduce the pain. Okay, so that is the most preferred drug. Next is antihypertensives. Now we have studied so many classifications of antihypertensives, isn't it? So we could give beta blockers. If the patient is suffering with hypertension, we can give beta blockers. Now beta blockers will again reduce the workload on the heart. Okay, example are propranolol, metoprolol, and atenolol. Next is we can give calcium channel blockers. Now what they do is they increase the oxygen supply to the myocardium. The most common drugs that we give is amlodipine, nifedipine, diltiazem, okay, and verapamil. Next is some other antihypertensives also can be started. Okay, it is not that only those antihypertensives are given. You can also give AC inhibitors like captopril, enalapril. Okay, you can also start with the diuretics like your Lasix or furosemide. Okay, now commonly whenever there is angina, we prefer anti-anginals, I told. Okay, so anti-anginals are used to treat the angina, and there are some combination of drugs that come under anti-anginals. That is your nitrate, that is your nitroglycerin. Okay, nitrate example is nitroglycerin. Beta blockers also are anti-anginals, and calcium channel blockers are also anti-anginals. Next is we also have to start with antiplatelet agents and anticoagulants. Now, especially in the patients, when there is a chances of clot formation, or if platelets can aggregate together, what will happen? The risk of development of stroke or the risk of getting MI will increase. So we have to inhibit the platelet aggregation. Okay, that is, we have to inhibit the formation of the blood clot. So for that we will be giving certain drugs, that is antiplatelets and anticoagulants. Okay, example is heparin, aspirin, clopidogrel. Next is thrombolytics or fibrinolytics. Now if the clot is already there in the blood vessel, okay, what we have to do? We have to fuse the clot, or we can tell lysis of the clot. Okay, the clot has to be dissolved. For that we have to give streptokinase and urokinase. Those drugs can be given. Next is most of the time these patients may be having excess of cholesterol in the blood, okay, or excess of lipids. So to lower the level of this cholesterol or lipids in the diet, what we can do is, one is ask the patient not to take excess of fat or oil. One more is you have to give this lipid lowering agents, which is called as statin. Okay, the name is ending with statin, so remember the examples also easily: atorvastatin, lovastatin. Okay, there are a lot of side effects of these lipid lowering agents. Okay, now next is moving on to antiarrhythmic drugs. Now antiarrhythmic drugs are mainly given if at all we suspect arrhythmias, that is change in heart rhythm or heart rate. Okay, commonly when a person is having a heart attack or anginal pain, what happens is there will be change in the ECGs, as well as patient will experience arrhythmias. Okay, so life threatening arrhythmias are there, like your ventricular fibrillation, ventricular tachycardia, that is very harmful. Okay, so to avoid that, we will give this antiarrhythmic drugs like amiodarone, lidocaine, adenosine. Okay, cardarone, so many drugs are available. Next, moving on to non-pharmacological management. Always remember that when a person is having chest pain, you should give bed rest to the person. Don't allow the person to move this side, that side. Okay, strict bed rest is asked, because what happens is if you are running, moving, walking, the workload on the heart will start to increase. Okay, we have to reduce the workload on the heart. So adequate bed rest has to be given to the patient. Okay, Next is emotional rest, that is reducing the stress or tension, that is best thing, okay, so that again you will not be tensed, it will not stimulate your sympathetic nervous system. Next is, I told already, emergency means we will usually start with the oxygen. Then next is what you have to do, monitor for the chest discomfort or chest pain and monitor the ECG. Okay, and when patient is connected to the cardiac monitor, check for the oxygen saturation. Okay, and immediately when a person comes with chest pain, what they do is they will collect the blood investigations. Along with that, the most important blood investigation is cardiac enzymes, isn't it? Like troponin, we have got CKMB that already I have discussed in detail, myoglobin, all this blood investigations have to be done so that we can detect if it is because of heart attack or because of any inflammation to the heart. Next is, it is very necessary to teach the patient how to control further attacks and what are the signs that will be there. Okay, and tell to the patient that whenever they are experiencing pain, they have to take rest and they can sit or maintain a semi-follis position. Continuously ECG has to be taken, reduce the anxiety of the patient, and self care has to be taught at home. Like immediately when they are experiencing chest pain, they have to take nitroglycerin. It should be readily available, not that you are telling someone to get the tablets when you are going to develop the chest pain. Okay. So remember that all these emergency medications have to be available at the home. Meanwhile, you have to also explain about the side effects of the drugs, because most of these drugs will reduce blood pressure and may result in giddiness or what we call as dizziness and even orthostatic hypotension. Next is educate the person regarding all the precipitating factors. Last class we have seen regarding the precipitating factors like your very extreme temperature, very cold or very hot, having heavy meals, isn't it? Or taking too much of coffee or caffeine, then excess of stress, okay, tobacco products, all these are precipitating factors. So all these factors have to be avoided. Okay, so to remember the precipitating factors, there are 4E. That is also a mnemonic. Remember, first E means exertion, eating, excess eating, emotional distress or stress. Next is extreme temperature, too hot or too cold. Next is always advise to the patient that they can take a maximum of 3 nitroglycerin tablets. Okay, nitroglycerin tablets readily can be placed under the tongue. So that is why they are referred as sublingual tablets, and each tablet you can take 5 minutes apart. Okay, once the pain has reduced, you can just spit it out. Okay, and next is always we have to advise the patient to control their blood sugar levels and also to control the blood pressure. Okay, and they have to continuously monitor the lipid levels and also try to control the cholesterol levels. Okay, and when they are monitoring the blood investigations, tell them to check for fasting blood sugar, which is taken in the early morning after 12 midnight fast. After 12 midnight they should be fasting, and early morning they will take the blood sample for FBS. Random blood sugar means they can check the blood sugar levels at any time. Okay, then RFT also can be done, that is renal function test. Okay, so there you can see the patient is placing the tablet under the tongue. Okay, next is advise the patient for regular exercise, because regular exercise, one is it will reduce the weight of the patient and it will help to improve the blood circulation. Next is quitting smoking is essential, because we know that whether it is tobacco or whether it is cigarette smoke, they have nicotine in it, isn't it? Which is very harmful for the endothelium. Next is encourage the person to reduce the weight. Okay, and ask the person to reduce the intake of red meat, oil, and high fat dairy products. Okay, tell the person to take small and frequent meals, and also the diet should be rich in fibers and less intake of salt. So this is a pyramid which shows how they have to take the food. Okay, excess or more of vegetables and fruits, whole grains preferably should be taken, seafood, poultry, lean meat, and low fat diet can be taken. Okay, then next is beans, nuts, seeds, oils, next it will come, and then minimal sweets have to be consumed. Okay, So teach the patient regarding lifestyle modification and how they can reduce the anxiety and stress that we have already discussed, isn't it? Like relaxation therapy or yogas, all this can be taught to the patient. Next is surgical management. This already I have taken in IHT or coronary atherosclerosis. So again I am not going to repeat it. Okay, that is your PTCA, then CABG, mid cap, op cap, okay, TMLR as well as laser ablation I will deal now. Atherectomy is also dealt, embolectomy and thrombectomy is also dealt. So what is this laser ablation? Now lasers are actually used along with the balloon angioplasty. Already I told in balloon angioplasty what they are doing. A balloon tipped catheter is usually passed from the femoral, radial or through the brachial artery, isn't it? So here also along with the balloon angioplasty, they are passing the laser light. And the laser light, once it reaches a stenosis or obstruction, it will be passed there. Okay, so once that catheter with the laser light, once it reaches obstruction, they will pass the light on the plaque or deposit. So what will happen, it will break or destroy the atheroma or the plaque deposit. Okay, so that is called laser ablation. You are using a laser light to um, destroy the atheroma or plaque. Next is TMLR. Some places it is called TMR also. That is transmyocardial laser revascularization. So this is the newest type of surgery, and here it is we are using this laser. Okay, we are using the laser light to create some tiny channels on the heart muscle. Okay, so we are using the laser light to create some tiny channels on the heart muscle. Okay, and particularly we also create it in the ventricle, because we know the ventricle is the main pumping chamber. Okay, so this tiny channels are probably done more on the left ventricle. Now it is told that when we create these tiny channels, they will carry the oxygen or the blood flow to the part which is obstructed. Okay, so that is why you are creating the tiny channels. Okay, remember that the tiny channels which are created will be carrying the oxygen to the entire myocardium. Okay, and the exact mechanism what it is and how it is, it's not known, but remember that you are creating some new blood vessels. Okay, that is tiny channels are created on the heart. Okay, to improve the blood flow or oxygenation. So this is the figure of PTCA. Already I think you might have drawn it. And then CABG, that is also the next surgery. Okay, so many grafts I have already discussed, isn't it? Like the great saphenous vein, internal mammary artery or internal thoracic artery, isn't it? Then radial artery. Atherectomy was also discussed, where you are taking a device which is having a cutting blade like structure, and that will trim off or will shave off the atheroma or plaque. Next is moving on to complications of angina pectoris. So remember, since it is a chest pain, most of the time it can progress to any other cardiac problem like cardiac arrest. Okay, sudden stoppage of the heart. That is called cardiac arrest. Next is it can cause heart attack or myocardial infarction, because maybe certain part of the myocardium is not receiving enough blood flow. So what will happen? Further, there can be ischemia, necrosis, and that may result in MI. Sometimes there can be rupture of the myocardium. Okay, and commonly it is seen that abnormal accumulation of fluid can be there in the pericardial sac, that is called as pericardial effusion or cardiac tamponade. Okay, then what happens is there can be dislodgement of the clot or the thrombus, and that may cause arrhythmias, cardiogenic shock, heart failure and acute pulmonary edema. Next is moving on to nursing diagnosis. I will not discuss the nursing interventions, you have to write it by yourself. So remember, when you are doing the nursing management, you have to assess the precipitating events, see for the pain, level of pain, quality, radiation of pain or severity of pain. T is for timing. Next is nursing diagnosis, acute pain related to decreased myocardial blood flow, activity intolerance related to imbalance between oxygen supply and demand, ineffective cardiac tissue perfusion secondary to coronary artery disease, deficient knowledge related to lack of exposure and inaccurate misinterpretation of information. Okay, for this interventions you have to write by yourself, like assessing the level, duration or type of pain, then keep ready the diversional therapy, then give the pain medications like morphine as advised by the physician. Okay, for activity intolerance, we know we have to follow bed rest for the person, but once the person is slowly recovering, early ambulation is started. You can teach some active or passive exercise to the patient. Okay, and moreover, you have to assess the patient in their daily activities. Ineffective cardiac tissue perfusion, for that you have to monitor and you have to assess the CVP of the patient. Okay, or you have to monitor the hemodynamic monitoring, see for the blood circulation. Okay, like SpO2 can be checked, capillary refill can be checked by the patient. Deficient knowledge related to lack of exposure, mainly what you have to do is speak with the patient and the family members. Okay, and try to reduce their doubts and ask them to ask more of clarification. Next is anxiety related to cardiac symptoms. Because patient is having severe chest pain, most of the time they may suspect that they are going to die. So fear of death is very common. Okay, so this is regarding angina pectoris.